Trish says, are other metabolic conditions linked to PCOS?
Yes, so great questions. As I mentioned, PCOS has a wide range of psychological, metabolic, reproductive effects, and it is linked to a higher rate of type 2 diabetes, because we know insulin resistance is the main driver of PCOS, and that's contributing to a lot of the symptoms we already mentioned, like the acne and things like that. Insulin resistance appears to be the main driver in at least kind of around 70%, sometimes even higher number of cases, and over half of all women with excess weight and PCOS will develop type 2 diabetes by the time they're 40, which is absolutely staggering. They've also, if you've got PCOS, you've also got a twofold increase of gestational diabetes, which is diabetes in pregnancy, and a higher risk of other issues as well, like potentially cardiovascular disease, although we do need more studies there. And studies do show an altered lipid profile, so higher LDL cholesterol, and also things like higher blood pressure. We know that in pregnancy there can be several complications as well. So yes, and if you're not menstruating regularly, so as I mentioned, at least 4 periods a year, you want to have a period every month, that's really what you're aiming for, then you might be given a pill to bleed, because you've got higher rates of endometrial cancer or womb cancer as well in PCOS. So yeah, we've got to get that checked out. And as I mentioned, I don't think I did mention, but it's the #1 cause of infertility, and that's because you're not ovulating. So obviously if you're not ovulating, you can't get pregnant.
Yeah.